Remember, chief complaint is the primary reason why the patient is an essential step to an accurate diagnosis and appropriate diagnosis. In this bit of learning, example, we will review the essentials. Okay. You will know you are successful if attending does not interrupt you and asks no or few questions when you are done. Remember, chief complaint is the primary reason why the patient came to see you. It is always a symptom. History of present illness is the patient's story received, filtered and processed by you in such a way that all of You probably learned this or similar mnemonic in med school, remember? Context describes the circumstances surrounding the onset of symptoms. I am so sleepy must be that damn wine. Remember, pertinent past medical history here is not a laundry. Severity is how severe the chief complaint symptom is, often on a mild, moderate, severe or 1 to 10 scale, but can also be a direct quote from the patient, for example, intense, really bad, or not as severe as my previous episodes. Associated symptoms are any symptoms described by the patient that are directly related to the chief complaint. You need to filter the flow of information and decide which other symptoms are relevant to include here. Modifying factors include anything that exacerbates and alleviates the chief complaint and treatment so far, anything that the patient has taken or done in an attempt to improve the chief complaint, and any other physician evaluations. Finally, other details are any patient responses to your questions that do not clearly fit in one of the elements described above. This is where you should include why now and patient's goal for the visit. So what will your presentation look like? John Smith is a 65-year-old male who presents complaining of low back pain that began approximately 4 years ago while he was mowing his lawn. Symptoms have been intermittent since onset and he rates them as moderate. Patient reports the symptoms are located. The patient is a 4-year-old right-handed female who presents with mother for evaluation of wrist pain that began 2 weeks ago after being involved in a motor vehicle collision. During the accident, the mother's vehicle was rear-ended at approximately 15 miles per hour and sustained minimal damage. Patient was restrained in the car seat in the back of the vehicle and there was no airbag deployment. Patient did not complain of pain immediately after event but began to have pain the following day. Patient's mother reports the symptoms are located in the patient's left wrist and describes the pain as aching. Per mother, the patient has had associated decreased use of her left wrist secondary to pain, but she denies any weakness or numbness distal to the wrist or any other injuries sustained during the accident. Symptoms are exacerbated with movement and have not improved with Motrin or Tylenol. Patient was evaluated in local emergency room after the accident and the imaging was reportedly negative. Mother is seeking care now because symptoms have not improved and she is concerned that something was missed. Her goal for the visit is to have an effective treatment plan which will result in rapid improvement. You may want to take a picture of this.